catalepsy after fright, nervous shuddering, trembling, convulsions. Then we have weakness. Gelsemium is usually very weak, and so he is worse motion. As an acute constitution, Gelsemium is very short-acting, with slow development, and usually in warm climates. So he has congestive colds or headaches or congestive diarrheas. Slow, several days after the exposure, with hot head, red face, cold extremities. So, in acute illnesses, Gelsemium is used and has a characteristic picture in common colds and in headaches. What I want you to grasp is the essence and the profile of the Gelsemium. It is not a frequent chronic constitution. In fact, it is a rare one. And also Thuja is a rare one. Especially nowadays at the syphilitic era we live in, such greatly psoric constitutions are rare to be found. And we find these constitutions mainly at early age, at the childhood or teenagers, and maybe at young adults. But they are characteristic, and it is important to know them. Then we go on with silica. What is the essence of silica? The essence is that it is a psoric constitution, and it is it has this stage fright. We could also think that it is a chronic pulsatilla, as Kent says. But the main thing is that she has this characteristic stage fright. That is, she doesn't want to appear in public because she believes that she will not do well, and most of the time she doesn't do well. She tries to avoid appearing in public. If she appears, she doesn't do well most of the times. Differential diagnosis from argentum nitricum. Argentum nitricum, being obsessive, has this great anxiety before the event. And this great anxiety causes many times frequent diarrhea, nervous diarrhea, and nervous frequent urination. But when the time comes and he goes on the stage to talk or starts doing the examination papers, or the appointment starts, then he gets well, he does well. It is his anxiety, his stress is mainly before the event. And it is an obsessive personality, with great restlessness. Differential diagnosis from lygopodium. Lygopodium has this great tendency to have a good image to others, that he is intellectual, cultured, kind, and so on. So, having this great tendency, he's got great stress in order to succeed. So he has this anxiety before the event, before going on stage, but after he gets on this, 1 or 2 minutes after he gets on the stage and starts talking, he does very, very well, and he enjoys it. Even if years have passed and he has great experience and he knows the subject well, always before the event he will have some stress. But then very quickly he gets over it, and you can't take him down from the stage. He wants to talk and talk. Valeriana has stage fright because she is very insecure. She projects herself as being very dynamic and self-confident, but she is very insecure inside and tries to hide it. So, in the event that she will expose herself, she has this anxiety, but she manages to cover it. Stage 5 also has Gelsemium and Thuja, as we have talked about their essence. Gelsemium due to great timidity, Thuja due to great lack of self-confidence. Thuja is psoric. It is a more psoric, it is psoric, that is introvert, but not greatly introvert. Fears and anxiety, psoric ones. Mostly lack of irritability, but at times she may express herself. And then you say, whoa, I didn't expect that from this person, which was usually psoric and not irritable. Then we have this characteristic that she is the chronic pulsatilla, or that Kent says that she is the chronic pulsatilla. Yes, she is less emotional, less crying, less weeping, and she is cold, not hot. Where's cold? In fact, there are certain very important physical characteristics. That is, she's wears coat 3, wears coat 3 especially to the head. If she has a bath and doesn't dry up her hair and goes out, then she easily catches cold. Wears cold, catching cold easily. Nails, brittle nails. Her nails turn inside and cause injury to the fingers or to the toes. brittle nails, problem with the nails here, the tissue, styes, tendency for styes, tendency for suppuration, problems with the nutritional problems and so on. Let's complete, no. You will complete the picture from the classical miasmatic constitutional materia medica. What I want you to grasp from silica is the essence. Psoric, stage fright, tired most of the times, a chronic pulsatilla. These are the main characteristics, and the very important physical characteristics, plus aversion milk 3, worse milk 3 or 2. Other constitutions that have an aversion milk is natrum carbonicum and natrum muriaticum, and Lycopodium at an older age, when his digestion has problems. From what you have seen, when we have described frequent and great chronic constitutions like Valeriana, Lycopodium, Sulfur, Nux vomica, Argentum nitrium, we have talked for hours, and we have given many psychological characteristics and symptoms. When we talk about less frequent or not so great chronic constitutions, we only have certain specific characteristics. Yet they are also important, because if the individual needs such a constitution, such a remedy, then it is important to give it to the individual. Thank you.